All right, good afternoon, Dr. Pongpech Singhara. My name is Danny. I work with Link, and today we're just going to be talking to you about a few things, especially neurovascular anatomy, and how you think it's still important for modern day neurovascular practice.
I think neurovascular anatomy is not just important, it's just fundamental. It's a must that you must know well before you start to drive a car through the road that you need to understand all the road, the possibility of the variation of the neurovascular anatomy. The functional neurovascular anatomy is very important. Before you go to some kind of fancy practice, uh, like the course with Link. I'm very impressed by the way Link here, but you can see that we try also to emphasize the importance of vascular anatomy in almost every cases here.
Yeah, definitely. And I think that, even with the new devices that we have now, the modern day imaging that we have, it's very important to know your neurovascular anatomy, especially for new trainees. All right. So, in your own practice, how do you integrate the knowledge of neuroanatomy when you have all these very modern, new age imaging techniques that you do even before you do the case?
That is the very helpful devices because right now you see down to the perforators, ophthalmic artery, anastomosis, anterior choroidal, which you never seen before. Clearly, the perforators from everywhere that you actually combine with your knowledge of anatomy, and you prove that I know that this basilar tip variation, I must have the perforators coming from this, and all the current images are now proof then you're right. It's just a assistant, a good help for you to see that. I can also put an example of spinal arteriovenous disease that before that we are afraid of the new coming doctors are afraid of anatomy there, but actually it's the most simple anatomy compared to the brain. And if you know well, you will be able to treat spinal arteriovenous disease in the safety version that is very special for the spinal vascular.
Yeah, no, I think that's a very important point. And in our own program, when we have our fellows, we have these, weekly conferences where we really emphasize, before you touch a patient, you have to read up on both the anatomy and the clinical case so that you're a safe operator. I'm not sure who it was who said that, the cheapest way to be safe is to know your neurovascular anatomy, right?
Yeah, you're right. You're right.
Yeah. So, you have any more to add?
No, I'm saying that even, the very smallest so-called commissural arteries can be seen now by all the modern devices, and it's really helped to emphasize the knowledge that we know since a long time ago. So please, all of the new generation, please keep on knowing the neurovascular anatomy.
All right. Thank you so much.
Thank you.